Bien. Okay, good afternoon. Warm welcome to our last webinar session today here at the first day of the virtual fertility fair. Here today with us is Dr. Ruth Sánchez and Marta Sancho, both from the HLA Vista Hermosa clinic in Spain. Very happy to have you here on board and to have you with us. In the coming about 20 minutes, we will hear now from Dr. Sánchez, why do patients come to Europe and to Spain in particular for egg donation treatment. I'm looking very much forward to that session. I'm pretty excited to hear what you have to say. The stage is yours. You can share your screen and your presentation, and we will be attentively listening. Thank you.
Okay. Now we are going to share our slides. Okay. Good afternoon. My name is Dr. Ruth Sánchez, and I am gynecologist in the EUR Vista Hermosa in Alicante. The talk today is named Why Patients from Abroad Come to Spain for IVF with Donor Eggs. First of all, I would like to explain why Spain for reproduction. Well, according to Newsweek magazine, Spain has the third best health system in the world. And according to the World Health Organization, in 2011, it was the fourth most visited country in the world within 57 million visitors. The Spanish are within the healthiest people in the world, sixth on life expectancy, 85.1 years old for women and 79.3 years old for men. Foreign patients may save between 30 and 70% depending on the treatment. And we can offer in a post-operation an excellent environment, a Mediterranean diet, high quality of life, nice weather, and what else? Excellent health professionals. We have a very wide offer for patients. The traditional tourist already knows Spain. He or she consumes complementary offers like culture, leisure, gastronomy, sports, rural, sun, and beach. I'm going to structure my talk in 8 points. The first of all, I would like to talk about the high quality in treatments and protocols. First, about quality standards. Next. We have the ISO 9001 and also an external audit by Osoa Biomedical Inc. We are registered in the official registration of centers, services, and health establishments of the different communities for all the artificial reproduction techniques. We have also national programs of external quality control for the assisted reproduction laboratory, and we also are in the national register of the Spanish Fertility Association, which is mandatory. We have also authorization to vitrify eggs, ovarian tissue, and posterior fertilization in programs of fertility preservation. About our success rates, we can say that in the first egg donation cycle, we can reach between 65 to 70%. In the second one, we are over 80% of success rates, and in the third one, over 90%. About IVF, it will depend on the age. It will depend on the age. The ranges are between 60 to 25% up to 42 years. About the genetic, all the genetic techniques existing nowadays in reproductive medicine are carried out in most Spanish clinics. At EUR Vista Hermosa here in Alicante, our genetics unit where all the techniques that are used in reproductive genetics are carried out, and it is located within the clinic. Clinics located within hospitals, they also have a DNA bank of donors, and we offer a genetic counseling service for a better diagnosis, treatment, and decision making. The second point is about the personalized care. We think of for us, the most important asset in the whole healthcare structure is the staff. In UR Vista Hermosa, we have agreements with hotels and apartments and taxi service. Most Spanish clinics have an international department to deal and communicate with our foreign patients and to help organize accommodation, transportation, and any other requests. We have 24/7 availability to talk to them in the patient's own language: English, French, Italian, German, and Portuguese. Our goals are to guarantee the most effective treatment, to provide personalized and private treatment, to reduce the level of anxiety of the couples, to transmit hospital safety, to uphold transparency and ethics, and to innovate and evolve permanently. The next point is about advanced technology. The most advanced technology is present at UR Vista Hermosa. We are able to perform all assisted reproduction techniques: ICSI, PGS, PGTA, time-lapse, MAX, sperm freezing and vitrification. We have our own sperm bank. Oocytes vitrification, we have an oocytes bank. Intrauterine insemination, egg donation, embryo donation, vitrification, and even ovarian rejuvenation. The fourth point is about costs. After reviewing your case, the most appropriate technique is indicated. In case of collaboration with an international center, we discuss and decide the treatment to perform and the protocol that the patient will carry out, trying to save money for our patients. The budget will be personalized and it will be very, very tight and competitive, so the treatments are accessible to most of our patients. It is very important to say that there are no hidden costs. What you see, it is what it is. All donors' costs are included. The transfer in blastocyst is also included. The ICSI is included, and also the DNA bank for donors is included, which that means safety and peace of mind. The next point is about legislation. We have to say that Spain has one of the most permissive legislation in Europe. It allows the use of artificial reproduction technique on couples, single and homosexual women. It allows gamete and pre-embryo donation anonymously and altruistically, although an economic compensation is permitted. The next point is to talk about the attractive country we have and the good communications. Alicante is located in the southeast of Spain, so that means we have a Mediterranean climate with an excellent air, sea, and road infrastructures. We have a wide variety of beaches, most of them with disabled access. 30 nautical clubs of high quality, more than 20 golf courses, most by the sea, and our offer includes food, beauty, wellness, leisure, and sports. We have also the higher proportion of foreign population among all the Spanish provinces, more than 400,000 foreigners here. The seventh point is about the hospital environment. UR Vista Hermosa in Alicante is located right inside a hospital, which means more security and trust in our treatments, with a multidisciplinary team dedicated to taking care of you. Well, just to conclude, I would say that in a not too far future, in the not too distant future, there will be a greater tendency to demand artificial reproduction techniques, and patients will continue looking at other options and countries. There will be an increase of the risk factors such as age, social, and other conditions, which mean that will be an increase of oocyte vitrification, fertility preservation, and egg donation. We will be improving in quality standards. Costs will slightly increase due to technical innovations, and there will be a better view and evaluation of the reproductive treatments. The genetic techniques involved in reproductions will be highly developed. And just to end, I can resume this talk saying that the choice of Spain as an artificial reproduction technique focused country is reinforced by our hospital location, our high technological level, that we have teaching and research units, we do a personalized care, we have tailor-made costs, and we have a very good international reputation over the years. Well, that's all that I had to say. Thank you for your attention, and if you have any question, it will be a pleasure to answer.
Okay, thank you very much, Ruth. That was a very, very interesting presentation. I will check briefly whether we have some questions at the moment available. Let's wait 1 second. I can see something. Or if we have them, maybe. Okay, so here's one. Where do the donors come from? Is there a waiting list for donors?
Well, most of our donors are here from Spain. They live here, but we have a very big pool of donors. They live here in Alicante, but we have of different ethnicities. So we have a very wide offer, and
Okay,
there's no waiting list.
okay, excellent. Good. Another question I have here is, can a patient come from outside of Europe, and what are the current COVID limitations for a treatment?
Oh, okay. They come. We receive patients from all over the world, not only from Europe.
Okay.
We have patients from USA, from Australia, from Asia, everywhere. And the restrictions, they are changing day by day.
Yes.
But so nowadays and today, with COVID passport on a negative test, there is no problem to come here to Spain.
Okay. Very good.
This is today. Tomorrow, we hope that
We don't know. We
we
don't
don't
know,
know.
of course. Yeah. Okay. How do we know for sure what is the cause of unsuccess?
Well, it's impossible to answer this question because it depends on the treatment. It depends on in what point it has failed the treatment, and in most of the cases, we really don't know because we
Mm-hmm.
have good endometrium, good embryos, high quality embryos, euplot embryos with good uterus, good endometrium. They don't get pregnant, they don't get a pregnancy. Well, it's very difficult to know because the success rate never reaches 100%. So
Mm-hmm. Of
it
course, yeah.
depends on the couple.
Okay, another question is, once you had an embryo transfer, how long do you then have to stay in Spain, or for how long should you not travel?
Well, you can travel even the same day. There's no problem traveling after the
Okay.
embryo transfer. We suggest that they don't travel this day just because some incidents can occur. So it's better for be more relaxed to travel the next day or 2 days before. But if it is necessary the same day, it is possible. But we prefer
Mm,
a day, almost one day.
okay. A personal question from my side. With all these happy babies born over all the years, do you still have contact actually with the patients, with the babies? Do you get maybe sometimes pictures how they grow and develop, or how is this relation, let's say, after the treatment is done and the baby's born?
Well, it depends on the patients. The patients from abroad, they always send us the photos of the babies, but in the US, most of them we don't have any news. But in
Okay.
patients from here, from Spain, that we have the possibility to take care of the pregnancy, we usually get more contact. But with foreign patients, it's more difficult to know. Uh, 2 or 3 years later
Hmm.
happen. But
Okay.
see, yes, Marta has told me that some patients come later here for holidays or with their babies, and they always come to see the babies for to
Very
show us,
nice. Yeah. Yeah.
and it's very grateful for us.
I can imagine.
Yes.
Okay, I have another question. What sort of screening do you undertake on the donors? And what kind of info, let's say, about the donors are patients allowed to know?
Okay. The donors, the donation here in Spain is anonymously, so we cannot give very much information. We always give the age, blood group, or blood group, and some characteristics of hair color, the phenotypic characteristics.
Okay.
And about the test that we make to the donors. They are mandatory to do some tests, serology test, genetic test, the karyotype, and we also have a genetic test of recessive illnesses in order to
Hmm.
make a matching, a genetic matching with the couples. For us, it is very important, and I think that tomorrow Marta, her talk, will be about this. It's a very, very important thing, and we we always recommend to do a genetic matching. But
Hmm.
in Spain, the legislation is very clear, which are the mandatory tests that we need to do to the donors.
Okay. Good. That was also the last question that I have received now. I think this was a very, very informative and very interesting session. I'm also very happy that sound and video and presentation worked all very smoothly. So thank you very much for joining this last session of our first day. We have 2 more days to go. We will have more webinars over the next 2 days. So there is more content, more interesting interviews and presentations to be seen. I wish you two a very nice Friday evening and nice weekend as well. I know we see tomorrow Marta with her presentation again. So yeah, in that sense, thank you very much, both of you, for joining. Have a nice evening. Have a nice rest of the fertility fair, and talk to you very soon.
Okay, thank you very much. Bye.
Bye bye. Thank you.